Welcome to part 4 of health assessment. We're going to focus on assessing the head and the neck. Assessing the head and neck involves the skull, face, eyes, ears, nose, mouth, sinuses, and lymph nodes. Now that doesn't mean us as nurses assess all of this. Depending on where we work, we may not assess all of these things. Things like palpating lymph nodes really are an advanced skill, leaving that for more like nurse practitioners. Our assessment will start with their interview, asking questions about their head and neck, like allergies, using corrective lenses or hearing aids, any head trauma, any oral and swallowing issues. We want to ask about any exposure to harmful chemicals like occupational chemicals and tobacco products. We also want to ask about any recent infections, which is especially important during seasonal peaks for influenza, RSV, and COVID. When we physically assess the head, we want to start with inspection. We want to look at the head for shape and size, making sure it's symmetrical, noting the skin color, distribution of hair, looking for any facial edema, and noting the person's level of consciousness and watching how the face moves when the patient speaks. We want to ask the patient to raise their eyebrows, close their eyes tightly, frown, smile, and puff out their cheeks. These movements help us determine if some of the cranial nerves are intact. We also want to gently palpate the head, assessing for symmetry and temperature. We can check the head for lymph node enlargement and hearing, but again, that's more of an advanced skill. And hearing, most of the time when we're assessing hearing, it's like, are they understanding what we're saying and are they answering appropriately? In like a hospital setting, we don't have the ability to assess hearing. Next, we want to inspect the eyes. They say the eyes are the window to the soul. Now, while that's up for debate, we do know that the eyes tell us a lot about the health of our patients. When we assess the eyes, we're looking for many things that can relate back to other body systems like the brain, liver, lungs, and red blood cells. First, we want to interview the patient, asking about any eye conditions, vision changes, and corrective lenses. Next, we want to inspect the eyes, checking for external eyes for any swelling, redness, or other color changes, looking at their eyelash distribution, and to see if their eyes are symmetrical. After we look at the external eye, we want to look at the sclera and conjunctiva. We either want to pull down their lower eyelids for the patient or ask them to pull them down for us. We're looking at the whites of their eyes, the sclera, for any redness, yellowing, called jaundice, any drainage or discharge. As an FYI, people with darker skin colors may have normal color changes to their sclera, having a lightish brownish hue, and this is totally normal. Sclera are not perfectly white. They have some variations of color, and they do have blood vessels, so we may see some redness in the sclera just from normal blood vessels. After we look at the sclera, we want to look at the conjunctiva, or the skin on the inside of the lower eyelid. Conjunctiva should be healthy dark pink to red, and we want to see if they look pale or if they look beefy red and inflamed. If the patient's low on oxygen or if they're low on red blood cells, we can actually have conjunctiva that are very pale and cyanotic. Next, we need to assess the pupils. When we assess the pupils, we're looking at several things at once. We're checking the pupil size, the pupil shape, and if the pupils react to light, and to see if the pupils accommodate and converge. And we call this checking PERLA. PERLA stands for pupils equal, round, reactive to light and accommodation, and PERLA is a normal finding. If you look at the picture on this slide, you will see what pupils look like when they're dilated and when they're constricted. Your eyes dilate and constrict based on light, so when we assess pupillary response, we're going to use a pen light. First, we need to see what size the pupils are in normal room light. How big are they and what is the size, and are they the same size? And we need to document this information. Next, we need to dim the lights and have our pen light or flashlight ready. Have the patient focus out in the distance and move your pen light from side to side, briefly shining it into each eye while watching that specific pupil that you shine the light in to see if it constricts when the light shines in it. Next, we're going to repeat shining the light in one eye, but we're going to observe the opposite pupil for reaction. The pupil that does not have the light shining it should also constrict. Then we're going to repeat it for the opposite eye. At minimum, you're going to be shining your light 4 times, twice on each side. Both pupils should react to the direct light in it and react to the light when it's in the opposite eye. If they do that, then we have pearl. We have the pearl of Perla. Next, we need a test for accommodation. This is tested by having the patient focus on a distant object, such as your pen light or finger, and then move the object 3 to 4 inches closer to their nose. So you're moving the pen light closer as like it's moving closer to the nose, and we want to look at the pupils when we do this. They should dilate when they look at the far object and constrict when they get closer, like to the closer object. That is accommodation. Also, the eyes should cross in as they follow the pen light. This is convergence. So when we're watching that pen light, like we're watching them move their eyes to follow that pen light in towards their face, we're watching those pupils to change and we're watching those eyes to cross in. So we're checking 2 things at one time. So nurses do not typically assess ears and sinuses as part of our normal assessment, but if you work in an area like an urgent care or an emergency department where complaints of issues of ears and sinuses are common, you may assess these. Assessing the ears for nurses is more of inspecting and palpating the external ear. Inspecting the inner ear is an advanced practice skill. We look at the external ear for color, symmetry, shape, and discharge, and we may palpate the ear for tenderness and pain. We also assess hearing, but not a formal hearing test. We may notice hearing issues just from when we do our general assessment and we're speaking with our patient, but we don't formally do any hearing assessments. When we assess the nose and sinuses, it's again going to focus on the external nose, inspecting for color, shape, size, and discharge. The sinuses, which lay above and below the eyes, may be swollen if the person has a sinus infection, so we may see some facial edema related to the sinuses. Any internal nasal inspection is more of an advanced practice skill. We may palpate the nose and sinuses for tenderness, and if there is sinus tenderness present, something may be inflamed or infected inside the sinuses. Assessing the mouth is another body part that tells us a lot of information about how the body is doing. It also entails advanced assessments that normal nurses don't do. But when we assess the mouth, we're looking at the lips, tongue, teeth, gums, hard and soft palate, and the tonsils. First, we want to do the interview with the patient and ask them if they have any mouth, throat, or neck soreness and any alterations in taste. When we inspect the inside of the mouth, we're using our pen light and we're looking at the color of the mucous membranes inside the mouth. Just like the conjunctiva, it should be bright pink to red. If it's pale or blue, we know there's an issue going on like low oxygen levels. We assess the moisture in the mouth as the mouth should be moist. If it's dry, the patient may be dehydrated. We also want to check the integrity of the oral mucosa, looking for any sores, and we want to look at the condition of the teeth and gums and the color and texture of the tongue. We also want to make sure that there isn't any unusual bleeding coming from the gums. The tongue should also be the same color red and same moisture level as the rest of the mouth, and there are diseases that can cause lots of changes to the tongue. When we assess the neck, we're starting with the interview, asking about any neck pain or soreness with swallowing or movement. We inspect the neck by looking for symmetry, color, and shape, especially around the trachea and thyroid gland area. We want to make sure everything is midline and that there are no bulges or lumps and bumps. Nurses do not routinely palpate the neck for lymph nodes or thyroid shape and size, and these are advanced skills. But we will inspect the patient for jugular vein distension, which is an abnormal finding related to excess body fluid. To check for jugular vein distension, we want the patient to sit back at about a 45-degree angle and have their head turned away from us. Using our pen light, we want to shine the light right over their neck and look for a bulging jugular vein. And we're going to repeat this on the other side as well. The slide has a picture of what JVD looks like as well as what a normal flat neck looks like. The picture on the left is the normal jugular vein, and the picture on the right is someone who has jugular vein distension. To finish our assessment, we want to have them turn their head side to side, assessing for range of motion, and have them shrug their shoulders, making sure they both rise and fall at the same height. And this is part 4 of head and neck assessment.